So welcome to the first of a few interviews that I'd like to conduct to perhaps give some insight into what it is that we do at Animal Health and Hydro, but to give it perhaps some insight from human medicine and human professions as well as from other veterinary professions. So today I'm fortunate enough to have Stephen Lowe with me. He is a biokineticist and has been one for the last 20 years. And we've had many conversations over the years. And I would first of all like you to explain, what is biokinetics? What do you do?
Okay. Well, before I start with that, just thank you for inviting me. And I think important for me to just note that Tanya and I have been friends for a long time. So not only have I been a biokineticist, but I'm proud to say that you're a friend of mine. Biokinetics in South Africa is a relatively new profession. And to break it down, bio means life and kinetics is movement. So essentially it's life through movement. I think it's quite unique in South Africa because what happens with biokinetics is we do the third phase orthopedic rehabilitation. In other countries, I've got a feeling that the physios do second and third phase. So I think it's maybe important to explain the differences between first, second, and third phase. And the first phase is probably not what we would deem rehabilitation, but more the diagnostics. So I would say that that's the purview of the doctors and the surgeons and the specialists. So they diagnose, and then quite often they intervene in the form of surgery, obviously depending on the nature of the injury. They might also prescribe medicine and so on and so forth. But for the most part, that's what we call first phase, is the diagnosis of the problem. In South Africa, physios can also diagnose. There's a little bit of a blurring of the lines there. But at the end of the day, one would argue that the first phase would be doctors, and that they do the initial establishing what the issue is, and then pretty much laying out where to go from there. And like I said, they also the guys who do the surgery. There's no blurring of any lines there. It's only doctors who are allowed to do that. The second phase would be what we would probably deem the recovery phase, meaning that there might still be tissue changes, there might be swelling, there might be pain, etc. And that's where the physios come in this country. Like I said, in other countries, they might also do the third phase. So they use their modalities to help regenerate, to help get rid of swelling, to help reduce the pain. And then final phase would be called the strength phase, and that's where the biokineticists come in this country. So somebody might have gone through surgery, and then they would have gone through the second phase rehabilitation, where they would get range of motion back. They would pretty much get back to normal in terms of movement or pain levels or so, but there's still a weakness component there, which, especially if it's somebody who wants to return to activity like sport, or in the case of animals, maybe they working dogs or they competition dogs, there's no way you can just leave them at the end of the second phase, because there would have been things like atrophy, neuromuscular changes, and things like that. So that's where the third phase come in, to get the person or the animal back to pretty much pre-injury conditions. So I hope that helps.
Okay, thank you. So when we're looking at, veterinary physiotherapy has just been promulgated and registered as a new profession in this country. And the Americans speak of physical rehabilitation, and the South Africans have now termed it veterinary physiotherapy. But based on what you've said, it feels as though we pretty much are responsible for not the first phase, but the second and third phase. So we're looking at a combination of, in human medicine, physiotherapy and biokinetics, because
So this could be an interesting little segue in terms of what happened in South Africa. Why does biokinetics exist? Because the truth is, like I said, in the UK and in Australia, definitely physios, they cover the whole scope. They can take somebody from first day post-op to 12th month post-op for an ACL repair, for instance. And I hope I don't offend any physios who watch this, but in some ways, I think in South Africa, the physios have focused very much on the second phase, and that has created this opening for a new profession, which turned out to be biokinetics, to do the third phase. I think it's important to know here that the scope of the physiotherapies in South Africa does include third phase, so they can actually do what we do. I think maybe medical aid has something to do with it in terms of people have got so much funds. So it's difficult for anybody, I think, to rehab somebody for 12 months.
Yeah.
So I'm not going to speculate on what it is. It is what it is. But you're right. And I think in America they call it physical therapy as opposed to physiotherapy, which, funny enough, is actually a term that I like more. I also really like the idea of somebody to do actually both phases. I think for the client, it would be great if you have somebody skilled like that who can start off early after an injury, go through that initial phase of getting rid of the pain, getting movement back, getting range of mobility back, etc., and then also continue into the third phase. I think continuity would be beneficial for the client and for the therapist.
Okay, yeah, sure. So we seem to have developed a situation in this country where obviously it's a new profession and there's a lot of new focus on us as rehabilitation therapists, animal rehabilitation therapists. And there seems to be a bit of a blurred line in terms of we will often see our patients, and I work with dogs and cats, we'll often see our patients only when there is a problem. So can you talk me through, or talk the listeners through, perhaps the importance or the relevance of second phase and third phase, as opposed to, well, my dog's 7 weeks post-op and not walking. So can we make the analogy between people and animals? And if so, is there a suggestion you would make in terms of that optimal treatment or therapy?
Look, I mean, in humans, the research has been done. I wouldn't be surprised if it's been done in animals as well, in terms of the physiology of injuries, the amount of time it takes for a muscle strain versus a fracture. So we know what the guidelines are in terms of how long it takes for things to get better and to recover. I believe early intervention is better, and I think sometimes, again, this might be slightly controversial, I think where the focus is going to have to be to try and educate and convince the first phase practitioners to buy into the profession, and I guess there's going to have to be, because it's a new profession, especially in this country, where they can actually understand the benefit of the second and third phase rehabilitation in terms of actually making it successful, the surgery or whatever the intervention was, but also the benefit to the client, which is far outweighed by waiting for longer, because there are changes. You can say whatever you want, but if there's a bad injury, if there's a surgery, etc., and the longer you wait, the bigger the changes are. So what you're doing is you're actually just prolonging the rehab process by waiting for longer. So I think education of the surgeons and the vets are paramount here, and for them to understand. And I think it should be a fairly easy transition to make, because I'm sure most of them believe in it already in terms of humans.
Yeah.
So for instance, playing devil's advocate, if you have a child who got injured on a football field, for instance, and you're a vet, I'm pretty sure you're going to be quite proactive in terms of getting to a doctor, and then if there's surgery, getting to a physio afterwards, and if there's a suggestion that they then go and see a bio for third phase, you'll probably be very good at that. So why not translate that to the animal as well? It's just logical, and it's not a pseudoscience. It's not something that was sucked out of anybody's thumbs. We know that the literature is clear that in order of regeneration, in order of neuromuscular regeneration, or the fact that the neuromuscular system shuts down after an injury or atrophy, all of these things take time, and the sooner you can start combating them, the chances are that you'll be more successful in your rehabilitation, which means ultimately that the surgery was successful. So if I can just add one more thing there, I think sometimes there's a thought that once the underlying problem is fixed, and let's use surgery again as example, and I'm going to use humans here. Say for instance, okay, so we're going to do a knee replacement, then that's fine. So there was osteoarthritis that was causing pain. We're fixing that, so everything is fine. But it's not true, because sometimes people have walked for a long time with that injury, so they've got bad muscle tone. Sometimes it takes them a long time to get to the rehab after the operation, for whatever reason. It could be financial, whatever the case may be. And they suffer, and quite often this leads to secondary problems like back pain or hip pain or whatever the case may be. So I think to just think that the operation is going to fix everything is a bit one-dimensional. I think there's secondary issues there, and again, that intervention of the surgery itself causes change, significant changes. And I think that's also where the third phase rehab is so important, because it's about retraining and about resetting patterns and about getting the person as back to normal as possible. Because again, there's a knock-on effect and things happen afterwards that sometimes I think a lot of people don't consider. That's important to me.
Okay, thank you. So would it be safe to, much of the physiotherapy research has actually been performed on people. There's loads of research on low back pain and the benefits of physio and the benefits of exercise therapy and rehabilitation in managing that problem. There's less information on these problems in dogs. Would it be safe to say that, and that research is happening and that research is coming out, but would it be safe at this point to be able to say, maybe not safe is not the right word, but to be able to say we're dealing with mammalian systems. The bodies respond and repair in much the same way. And because the evidence is there for humans, can we apply it to animals in the interim while the research is actually catching up?
Yeah, I think so, because at the end of the day, you're still dealing with the same kind of tissue.
Yeah.
You're dealing with muscle, or you're dealing with ligament or tendon or bone. So it's not as if they're an alien species who's got a different cellular structure or anything. You might find that as the research comes out, that because of the metabolism or whatever, the dogs might actually heal faster or slower. I don't know the answer to that, but to me it's a no-brainer that you can draw a direct line. Just because the research is not in terms of the work that's being done on animals. I don't think you can dispute the fact that the same principles apply of regeneration, of adaptation. It's going to be exactly the same. The injuries are pretty similar in terms of if a dog breaks a bone, it's the same, So I can't see. I can see that obviously, and this is a little bit off topic, that there's a difference in terms of rehabbing animals versus people. People are far easier. They can tell you and they can respond to requests and instructions, whereas animals can't. So that to me is actually, I've thought of it often, and I don't know how the hell one can do it, but at the end of the day, coming back to the physiology and the fact that you can draw a line from humans to animals and use the same principles, is just, to me, it's like falling out of a tree. It's self-evident.
Cool. I think that pretty much sums it up and brings this interview to a close. I thank you for your time, Stephen. I appreciate it. And in summary, I would like to say, if you have an injured dog or cat and you're not happy with its progress post-surgery or post-injury, look one of us up, find a rehabilitation practitioner or veterinary physiotherapist, and let's at least do a consultation and see how we can help you. Thank you.
Pleasure.
Great.
Sweet.